My name is Chris Kaiser. I'm with Carolina's HealthCare System in Charlotte, North Carolina, and I am the Vice President for Patient Financial Services that has a lot of responsibility for all of the front-end functions, so patient access, registration, all the way through to financial counseling, and then I'm kind of the liaison for the patient experience. Carolina's HealthCare System is the largest healthcare system in the Carolinas. We're affiliated with around 41 hospitals. In our core market, we have a certain number of those hospitals that make up our primary enterprise, which are the facilities that are wholly owned by Carolina's HealthCare. And those are the ones that we primarily work with, that we do all the registration, billing, collections activity for. Okay. I think our biggest challenge that we've really tried to focus on is patient engagement and putting the patient first. We have a slogan at Carolina's HealthCare System, patient first always. And how does that come into effect with patient financial services? What's that interaction? How does that look? And that's what we really tried to focus on, is looking at how we could take a traditional collections approach and apply that to putting the patient at the beginning of that. 2009, our self-pay account process is everybody went to an early out vendor. So basically every account that we had would go out to a vendor, their number would be on our statements and things that were for that segment of the population, and everybody was treated the same. There wasn't any segmentation or anything that we did to try to manage those accounts differently. We basically treated all patients like patients that did not pay their bill. Instead of really trying to focus on which patients were likely to pay their bill, let's use that early out for patients that were not as likely to pay their bill, that could use some, we'll just say, extra encouragement. Carolina's HealthCare System has always been cutting edge when it comes to clinical activities. We were the first in the region to do transplant services, things like that. But historically, our patient financial services area, we did a good job at what we did, so we didn't necessarily see the need for a lot of change. Well, that has changed in the past 4 to 5 years, and we now feel like we're very cutting edge in what we do because we've been willing to embrace new technologies, embrace new ways of doing things to kind of break out of that, what I would call, old school financial services model. So what we really looked at doing was kind of using different tools to meet those goals of, one, making sure we treat patients as they need to be treated based on their ability to pay. Number two, we wanted to look at how we could reconcile what was going to our bad debt agencies and really get that vendor management underway so that we would have a good, tight process around which things were being sent out and then how well those things that came back, basically tracking. We really lacked some in tracking. We wanted to track that better so that we could be better partners even with our vendor agencies. And then number three was presumptive analytics. We wanted to make sure when it came to the charity process and the 501R regs and a lot of the new things coming down the pipe, we could do some of those things in a presumptive way to then try to manage them on the back end based on the presumptive results. Now we break people into categories based on their likelihood to pay. That's the industry term segmentation. We're segmenting those accounts. Everywhere from accounts that the patient has never paid, is not likely to pay, those go to bad debt very quickly. Then we have the accounts that we keep and work, or the accounts where patients are very likely to pay, we just need to work with them. And then those that are kind of at the lower end in the middle are the ones that we send out to our early out agencies because there need to be some more aggressive handling of those accounts because those patients are not as likely to pay and need some additional encouragement. We were blown away with the results of the segmentation process. We knew there should be some benefit based on industry standards and looking at what some other people were doing. We just stuck our toe in the water, did it gradually, and when we saw the tremendous benefit, it was how fast can we turn it on for some of our other facilities. I'm one of those people that what you see is what you get, and when we have vendors we enjoy working with, I welcome calls and I'll brag on those vendors. I also will be quick to tell people when we have vendors that have been a challenge and they've not been easy to work with. Connex is probably one of my top 3 vendors when it comes to relationships with feedback. They let us know when things are off course both ways. I think we have a good give and take with Connex in that if they see things we might need to improve or they have concerns about something we're doing, and likewise we can share that. So I think it's really all about collaboration. And you have some vendors that very much want to dictate how things are going to go. And so we welcome the collaboration with Connex.